Hesky Kutscher. I'm founder and CEO of CareDox. More importantly, I'm also a father of 3 healthy kids. With me in the back over there is my partner, Tony, who is a father of 5 healthy kids. We know we're very lucky people to have the healthcare that we have, but that unfortunately families all over the country aren't so lucky with the health of the kids, typically for reasons that are easily addressable. The world of pediatric health is actually quite sad these days. Chronic disease is on the rise. Kids with allergies are more than ever. And yet we're spending way more money today than we ever have before in pediatric health. And not only is this issue scary for parents, it's actually also very expensive for health insurers. So why is it that if we're spending so much money, that this is still persistent? Well, it really comes down to access. Payers and providers, as much as they may try, really have a hard time finding families and engaging with them in the way that they need to be engaged. And not to mention families who oftentimes can't find the right health care for the preventative care that they need within the vicinity, so they access it to the emergency room, which is hardly the right way to access the healthcare system. We figured at CareDox that there must be a much better way. So we decided to partner with what is the largest healthcare network in America, the K-12 public school system that sees 51 million children every day. We at CareDox connect the dots. We go into the schools, we provide them a technology platform to help them manage their health, engage with parents, and we add to that by bringing healthcare to the schools themselves, since that's where the kids are, so we could provide healthcare in a convenient way for the families. So our adoption rate has been incredible. CareDox is working today with over 7,000 schools. That represents just under 5 million kids of students around the country. Mostly we started off with vaccines. We've done just under 1 million vaccines nationwide, and now we've launched in Clay County, Florida, our adolescent welfare program with physicals, and we're taking those learnings of how to engage parents, provide health care in schools, to chronic disease management. With me to share the program that we're launching for asthma is Dr. Robin Deterding. She's the head of innovation at Colorado Children's and the head of the Breathing Institute at Colorado Children's. So, yep. Robin?
Yep, thank you, and hello, everyone. So I was at this conference 2 years ago, and I heard Hesky speak, and I said, that's the secret. And the secret, let me give you a little feel for what it feels like. So I've been a practicing pulmonologist, still practice, and kids come to see me in the office for breathing-related disorders, which, by the way, are the most common problems of childhood, asthma being the most common problem, with over 10% of the pediatric population having a diagnosis of asthma. So let's say Joey comes to see me in the office. It is a blink in a moment of time that I see Joey. And let's say Grandma brings Joey, and I say, how's Joey doing with the asthma? Yeah, good. Well, what does that mean? Well, I could call his mom, but I think he's doing good. Okay, has he been in the hospital? Nope. So as a physician, I'm like, okay, Joey's doing good. But what I don't know when mom calls me back is that Joey's been in the nurse's office at school every day that week. The schools are where the children live. And it's really important in those chaotic homes because it's impossible for a child with chronic illness to care for themselves in those environments. The schools are the safety net of health for children. So when CareDox, I heard about CareDox from an innovation center, I said, that's it. Now, we had another secret sauce that we bring to this, and that is my colleague that I'm honored to work with at the Children's Hospital, Stan Zeffler. He's been working for 15 years and dedicated his life to studying asthma. He's had multiple grants working in the Denver Public Schools and Aurora Public Schools to figure out what's the best way to do this. And through these learnings where he's focused on education, severity assessment, access in the schools to the right thing, and monitoring, he's been able to create the following outcomes. 80% reduction in hospitalizations and ER visits, 50% of those in the most severe asthmatics, and 20% reductions in school attendance, and the schools care about that. So the secret sauce is you take this great thing that has local access. He's worked with 32 grade schools, great. And I told Stan, you've done great work, but you know what? If you only do it in Denver, it's not good enough. And so CareDox, the secret sauce is really transforming and scaling what Stan has known and learned to a wonderful platform like CareDox, and do it now throughout the country. And it has multiple wins for the kids, for healthcare, and for my investigator, Stan Zeffel, who now is going to have data to fix asthma even better than before. So as an innovation center, we're thrilled to be here, standing on the stage and releasing this product. It's live in Florida, and we think we can reproduce some of those outcomes that have been high touch now with IT touch.
Thank you so much, Robin. And what we've been doing now at CareDox is taking those protocols developed by Dr. Zeffler, embedding it into the technology and the workflow with the right training and the right product so that the school staff can really become a part of the care management team. And that will have a dramatic impact. Our goal is to take what we started in Clay County to our 7,000 schools all over the country. So we'll be partnering with some of our existing schools, but more importantly, with the payers nationwide. This program is now provided for free, and I'll repeat that again, it's at no cost to schools or families, so that since the payers are happy to fund something that saves them funds from hospitalizations. We at CareDox know that the current way of treating children is broken. And so our mission is to enable every child to get the care they need, no matter where they live, no matter who their parents are. And we're not just going to be stopping with asthma. Soon, behavioral health, mental health needs, diabetes and obesity will all be coming behind these programs in other parts of the country to make sure that all the children around the country can have the bright futures that they deserve to have. Thank you very much.